Welcome to Healthy Smiles.
Hi, my name is Dr. Ved Berani. I'm the lead dentist doing sleep dentistry at the practice. Sleep dentistry is one of those treatment modalities we use quite often with anxious patients who obviously have some sort of phobia or anxiety about coming to the dentist. Sleep dentistry is also called sedation dentistry, and in general, sedation dentistry is using some sort of anti-anxiety mechanism to make dentists help patients cope better with complex dental treatments. Patients who come and see us here for sleep dentistry travel far and wide. Most often they've gone on to websites like Google, where they've looked up what are the different options for the anxiety. And sleep dentistry starts off with first knowing the patient and understanding what their real needs are. Some patients have phobia of the needle, some don't like the noise of the drill, and some patients just don't like the smell or just the feeling of somebody poking into their mouth. With use of certain kinds of drugs, and starting as little as oral sedation or sometimes even laughing gas, we can help patients calm down so they can then have that ability to cope with dental treatment. The 4 levels of sleep dentistry that really exist are starting with general anesthetic, which is where the patient is fully unconscious, and this is usually done in a specialized day surgery center with the help of a specialist anesthetist. The second most common, which we do actually in-house here in our dental practice, is what we call as intravenous or twilight dentistry. And twilight dentistry is where, again, a specialist anesthetist would come in here and we would put an intravenous line through your veins which help the drugs make you consciously sedated. You are sufficiently relaxed, but at the same time not unconscious. The main benefit of intravenous sedation is where the costs are half of that of general anesthetic, but at the same time the recovery is much better. The third most common form is what we call as laughing gas. So a mixture of oxygen and nitrous oxide, and this is what we call relative analgesia. This helps patients not go to sleep but feel sufficiently relaxed, and it also acts like an analgesic. And this helps patients cope with dental treatments while they're in the dental chair without having to spend too much money. Another form of sedation dentistry is also use of something called as penthrox or the green whistle. It is frequently used for short procedures, and especially for patients who do not really like having a needle in their mouth or afraid of the jab. Almost everybody is a really good candidate for sedation dentistry. Most dental procedures which are complex, such as extractions, wisdom teeth, root canals, and even complex treatments such as implants, are usually very taxing for the patient. So from our perspective, as long as the patient is medically fit and is able to cope with the level of sedation that we offer here, they are usually a very good candidate. The cost of sedation dentistry is a really good question, because often one of the myths about sleep dentistry or conscious sedation is that it can cost thousands of dollars. Well, that's not really true. For example, using laughing gas, which is a milder form of relaxation dentistry, could be as little as a few $100s for a long appointment, approximately 1 to 2 hours. And the cost of twilight sedation or intravenous sedation can be roughly between $500 to $700 an hour. One of the questions I'm often asked by patients who want some sort of sleep dentistry is, will I remember what happened, and am I going to have any pain during the procedure? When it comes to conscious sedation or twilight sedation, the drugs that we use for conscious sedation are the same drugs that we use for general anesthetic, but at a lower concentration. So most patients, when they get up, would tell us that they remember little or nothing of the actual procedure. The side effect of sedation is inability to focus or concentrate. So we highly recommend not driving or using any motorized gadgets after sedation appointment, and importantly, take a lot of rest and try and stay indoors. This will make sure that there's enough time after your appointment for the drugs to be eliminated from your body and you feel much better in 24 hours. The question is, why choose us as your dentist for your conscious sedation? We have been practicing conscious sedation dentistry for the last 8 years. Specialist anesthetist is all we use, and we make sure that every patient is first consulted and screened thoroughly to make sure they're a good candidate. At our practice, we are passionate about providing solutions to patients that are pain-free and anxiety-free. It is important before you choose your dentist to understand 3 things. 1. Do they have enough experience when it comes to sedation dentistry? Number 2. Have they gone through all the treatment options with you and given you understanding of your choices? We believe our patient should be the one making the decision, not us. And number 3, do they use a specialist anesthetist, and are they qualified to provide sedation dentistry within dental rooms? We have multiple sedation options and no one solution fits all. And we are happy to go through with our patient, depending on what their needs are, what is the right fit for them.
Come and see us.
We'd love to meet you.